Thank you, Professor Gautam, for inviting me to say a few words at the beginning of your course. I send greetings to my colleagues in Ludhiana, and I wish you well for this course on crisis resource management and patient safety. I think Purushottam asked me to speak because of our shared experience looking after critically sick patients when he was here in London, and we were doing liver transplantation together. We were often asked to help other surgeons who were facing difficulties with their patients, and as a team we would go and try and provide assistance. Sometime in the 90s, I had the opportunity to develop the notion of catastrophe surgery because colleagues of mine who were in the Canadian Armed Forces felt that they did not have sufficient experience of difficult situations when they were doing surgery in Canada, but were asked to look after very difficult problems when they deployed overseas. And in the end, we defined catastrophe surgery as the surgery required to help a single patient who had multiple severe injuries, or to look after multiple patients at the same time. It was our experience looking after critically sick patients with liver failure who had coagulopathies and severe dysregulation at the time that they were being asked to undergo the most severe surgery that we're able to undertake. And it was through the use of careful planning and the skills of an entire team that we were able to make those operations become fairly routine. Likewise, when dealing with emergencies, there is no greater training than having been in an emergency before. Therefore, for those who have not experienced emergencies, it is very important that you undertake courses and rehearse how you think you should respond given different situations. And these rehearsals will form the basis of a calm, collected approach by your team. I discovered that this was the way the Canadian Armed Forces worked when I deployed with them overseas. And we converted our experience into courses that we give here in Canada, which sometimes we call MASCAL. And while we were able to give them live in the past, we have now developed a platform so that we can give these courses virtually. Well, I look forward to hearing how your course went, and I wish all of you well. And I thank you for the opportunity to send this greeting.